Sean Forbes. I'm a recruiter with the Office of Human Capital within the Centers for Medicare and Medicaid Services. Welcome to the Hiring New in 2022 webinar series. This series is designed about all things recruitment, specifically at CMS. Today is a great webinar, not only because it's the last webinar of the year, but we're shining the spotlight on two extremely vital organizations within CMS, the Office of Communications and the Center for Medicare and Medicaid Innovation, also known as the Innovation Center. I really love when we have the opportunity to showcase the agency's work and the employees that make it happen. As you saw, this webinar will be recorded and posted to our YouTube channel. A colleague will post this in the chat box. We do have interpreters on the line, and closed captioning is available. Please click on the CC below, or if you don't see that, click on the three dots. We will be sending a follow-up email to all registered participants, which will include the slides. And if you have any questions for our panelists, for the HR specialist, or for myself, please ask them in the Q&A, and my colleagues will get back to you and answer your questions. So without further ado, we're just going to jump right into it. So today's is the Career Spotlight, and we're featuring the Office of Communications and the Innovation Center. Again, my name is Sean Forbes, and I'm a recruiter with the Centers for Medicare and Medicaid Services within the Office of Human Capital. So today we're going to talk a little bit about CMS, and then I'll introduce our guest speakers. Today on the line, we have Chris Kepke from the Office of Communications and Adrian Roseborough from the Innovation Center. At the end, we'll also talk a little bit about the Inflation Reduction Act and the hiring with that. And then also, if we have time at the end, we'll definitely stick around for questions. So what is CMS? So CMS is the Centers for Medicare and Medicaid Services, and it's the largest purchaser of healthcare in the world. We're responsible for Medicare, Medicaid, the Children's Health Insurance Program, and the federal health exchanges. These programs touch the lives of over 145 million people across the country. And it's CMS's mission to serve the public as a trusted partner and steward who's dedicated to advancing health equity, expanding coverage, and improving health outcomes. CMS is located just outside of Baltimore, Maryland, in Woodlawn, Maryland. We also have 10 regional offices throughout the country. We have also started posting a lot more remote work. So please take a look at USA Jobs and see which positions are being posted as remote. So who do we hire at CMS? So we hire a wide range of professionals, both entry level, right out of college, internships, and seasoned professionals. We hire everyone from health administration and health policy. So you'll probably see health insurance specialist a lot, which is really health policy or health policy analysts, social science research analysts, physicians, nurses, pharmacists, those with a healthcare background. But we also hire much more than that. As Chris will talk about later, who works in the communications office, we have a very large office in media and communications. We have a large office in the business, finance, and program support. So from everyone from financial analysts, accountants, human resources, and then those in STEM careers with IT specialists, data scientists, economists, and actuaries. So without further ado, I talked a little bit about the Office of Communications, but I know Chris Kepke can do a much better job at that. Chris, the floor is yours.
Thanks a lot, Sean. And Sean certainly knows a lot about communications, but I appreciate the opportunity to come here and talk about a little bit about the office that I work in and some of the work that we do. Sean had asked me to start a little bit about like my hiring experience. And so I was hired actually quite a while ago. We'll say in 2000. Applied, interestingly, didn't really know what CMS was at the time when I applied. Some people at CDC thought that I should apply for some work down there in Atlanta that I had applied for, but I also saw, that CMS, and they wanted a person who had my background. So I saw this was an announcement that had my background. And so, which is, I am a researcher, but I research how people communicate. I've kind of built that over the last 20 years into understanding a lot more about marketing and outreach as well. And before I came to CMS, a lot of my research was how people communicate in such a way to improve marketing and outreach campaigns on healthcare. So CMS needed that work a lot more, and I'll kind of explain a little bit why CMS needed that work. And they were looking for people who had that expertise. So I applied to CMS and I got a call. I kind of almost forgotten because I thought I'd maybe go to CDC. And when I came for the interview, I just really loved the people and the mission, that really providing access to people for healthcare, to people who don't have access to healthcare, or helping older people on Medicare, or people who lack resources, who don't have a lot of resources on Medicaid, navigate the healthcare system better. That just seemed to be incredibly powerful and important work. And so I was like, okay, I'm gonna come to CMS and work here. And so first, I'm working on issues around Medicare. A lot of what happened there is they started creating more and more Medicare plans that were offered by private companies. We call it Medicare Advantage now. And I thought, well, this is interesting. They wanted us to help people navigate that. That was kind of interesting. But I was like, am I going to spend 20 years doing that? And as it turns out, the answer is no. So doing that, but also because we are the largest payer of healthcare in the country, actually in the world, but in the country, we spend more money on healthcare. CMS spends a lot of time thinking about how we spend that money. And like if we spend a lot of that money, say, on hospitals, or on nursing homes, then part of the question is, well, like, how are we responsible for that, what we're buying in hospitals and nursing homes? So we've started measuring the quality of hospitals and nursing homes. There are star ratings for quality. So how do you make those star ratings available for individuals, for the general public, and useful in terms of making healthcare decisions themselves, in terms of driving healthcare quality? So I've gone from like, how do I pick an HMO, a Medicare plan, to how do I improve quality delivery in the country by promoting that information? Then the Affordable Care Act comes along, and we have to find people who have no access to healthcare at all. We have the CHIP as well was reauthorized. And so CMS as an agency, and this is work I did at the state level back in Pennsylvania, helping people with children find access to healthcare. But now on a federal level, how do we get people actual access to healthcare? Get them through the process of filling out an application and through the process of choosing a health plan and then using that health insurance. Those are just a handful of the topics and huge things that have occurred in my 20 plus year career here. Just to add one more little cherry on top of that. So when W. Bush was president, his number one policy was the expansion of Medicare to include Part D drugs. And that needed a lot of communications to get people to sign up. When Barack Obama was president, his number one policy was around the Affordable Care Act and how do we impact healthcare. A lot of, actually, I'm sure the work where Adrian works also impacted by the Affordable Care Act, as well as finding healthcare for people. So in working for, 4 different presidents, 2 of them, their absolute top domestic policy is to do with this agency. And that's been pretty impressive. And actually during the Trump administration, when COVID became a thing, they relied heavily on our agency to help, especially the elderly, people on Medicare, figure out how they can stay safe from during times of COVID. And so that's, again, another topic we shifted communications to. So it's ever changing. It's exciting. There's a lot here going on in the Office of Communications that represents literally what's going on in the agency as a whole. So Personally, I run what they call the strategic marketing group. That's where we worry about people's behaviors and of what they need to do in order to take advantage of programs such as sign up for the Affordable Care Act and or get vaccinated and or choose the right nursing home for a loved one, all of that. So we're worried about those types of things. We have social researchers who run focus groups and surveys. We have people with advertising experts. We have people with public relations backgrounds, lots of different communications backgrounds just in this group. The strategic marketing group is part of the Office of Communications, which runs two of the largest health call centers in the country, 1-800-Medicare, and then another call center for the marketplace. All the websites for CMS, almost all, except Medicaid.gov. But anyway, Medicare.gov, healthcare.gov, CMS.gov, all of that's in the Office of Communication. You need a lot of IT people, people who understand data sets, people who understand user interface, UX. We have a creative services group. We have outstanding writers who make the content pop and come alive and be interesting to people, as well as people who can run a television studio or radio production or graphic arts, all in the creative services group. People who have expertise in press relations in our media relations group, people who work with partners in our partner relationship group, because we work with partners that such as AARP for older folks, partners that work with different minority groups, different special interest groups, and different provider groups. And we have people who maintain those relationships with these partners. And I'm certain I'm forgetting someone important in the Office of Communications, but that just gives a wide view of what goes on in the office and what a wide variety of skill sets that we hire that all help make healthcare more accessible for people in the United States. So the biggest issues right now still, along with the Affordable Care Act, actually with the Biden administration, they've made some changes to the Affordable Care Act, making the access actually better, making the tax breaks for people better, which actually lowers the cost. So we're getting more and more people enrolled now as it's become more and more affordable. That's extremely hot right now. Different things around what we call the public health administration emergency, which you all would call COVID. That's created lots of changes within the agency that we've had to do a lot of work on that are hot right now. It's just ever changing. So if you're excited in a place that every year or two has a new exciting challenge and takes a lot of different skill sets, from someone who can write for the internet to someone who is a data scientist, somebody who understands the back end of IT systems. This is a great place to work. It really is. And like I said, I've been here now for 22 years and have been excited and started by going, I'll do this for a couple of years. And it's and the level of energy that happens here and the impact that we've had is just amazing. So if you're just curious about CMS as a whole, I can brag about all the other centers and offices too, because they do great work. But I'm going to turn it over to or back to Sean if he's going to turn it over to Adrian, but someone can give you an example of what that might be.
Thanks, Chris. And that's exactly it. Adrian from CMMI, or the Innovation Center, is up next. Adrian, the floor is yours.
Thank you, Sean. Hi, good afternoon, everyone. My name is Adrian Roseberg, as Sean has said. What I do at the Innovation Center, I've been with the Innovation Center for a little over 2 years now. I was brought in as a management analyst / talent development specialist. And what that means, my role is a little bit twofold. What I was brought in to do was to replace a contracting company that was here that was helping the Innovation Center recruit candidates, which is how I was actually brought in. They reached out to me via LinkedIn while I was working in HR at Capital One. And the main reason for them wanting to bring me in, because they wanted someone with a private sector mind frame to come in and kind of shape things at the Innovation Center in a private sector way. So like I said before, my role is a little bit twofold. So 50% of my role would be helping our different groups within our Innovation Center recruit for talent when it comes to, certain roles. Mostly it's been our health insurance specialists, our social science research analysts, economists, and a few other roles. And I do partner with Sean on quite a few of those and these meetings that we call strategic consultations, which is where, Sean and I and a few other people within the executive office staff, which is where I work, we'll meet with the managers and we'll kind of get a better understanding as to what they're looking for, how they want to post the jobs. Do they want to target certain companies? Do they want to target certain schools? What are some of the keywords that they want us to search for when we're trying to source candidates? So that's about 50 to 60% of my role. Another part of my role, I'll just kind of throw this in there as well. The role that I'm currently in was brand new. So I'm the very first person to ever fill this role. So I've been able to kind of make it my own. So what I wanted to focus on was, was there a gap when it came to recruiting college students? Because I'm not too far removed from grad school myself. So I kind of understand the challenges of trying to break into the federal government, straight out of college. So what I've been able to do, we ran a pilot last year where we worked with Johns Hopkins University out in, I believe it's in Baltimore, where we were able to partner with one of their master's program, a Master of Public Policy. And we were able to do a 2-hour showcase with them, pretty much something similar to this. Present CMI as an agency, have different groups come in on the showcase, tell them what type of work we do, what type of work they would be expected to do if they were chosen for, a residency position. And that turned out really well. We were able to pick up, 2 students who we did speak to about a few weeks ago, just to kind of get an update on how things have been going since they started over the summer. And they seem to have been loving the work so far. And from what they've been telling me, they would want to continue a career with CMI. So that was one of the things that I've been working on as far as trying to make this position bigger than what it is. I have been looking into other schools, partnering with someone in our Office of Human Capital, trying to make sure that we're not, doing the same type of work. The other part of my job is, again, like I said before, they wanted somebody from a private sector mind frame to come in and kind of just, change things that was happening at the center. They wanted to streamline a few processes. So when I say they wanted to streamline a few processes, the very first thing that I suggested was, revamping our onboarding process. Because I started during COVID and things were a little new, I didn't realize what it was like before I had joined. When I had joined, I was mailed a laptop with about 120 pages of documents that I was asked to read, and I was just like, okay, this is a bit different. So what I was able to do with 2 of the people that works on the executive office team, we were able to work with our SharePoint team and basically just redo the entire onboarding process. So we were able to create a SharePoint page where it's like a one-stop shop that you can get pretty much any information that you need, whether it deals with payroll information, union information, IT information. There's links to each of the groups within CMI if you want to learn more about them. And another process that, my director tasked me doing is looking at our retention rates, kind of going the exit surveys and kind of figuring out where can we pinpoint, different issues like, certain people or people may be leaving the agency. That's another project that I started working on. It kind of got pushed to the side because of some other things that had popped up that was more important. But now we're back into looking into that now. Another part of my job is looking at employer branding. How can we make CMI more? How can we make it more of an agency that people know that we actually exist? Because I didn't know who CMI was before I had joined CMI. So how can we attract more people, and how do we put the agency out there and compete with an HHS or a CDC or an NIH? Those I feel like those may be more of the popular agency programs. So how do we align ourselves with those type of agencies? So that's another one of the things that I've been doing. Some other things that I've been doing around here is, working with the director on trying to figure out how can we work with our different managers and help them utilize their LinkedIn. Pretty much, we want to make our managers, well, we want to tell our managers, you can use your LinkedIn when it comes to like these open positions. There may be people within their network on LinkedIn that, may not know about the open positions. And, we've been trying to do that. So those are some of the things that I've been working on for over the past 2 years, not as much as Chris. But again, this role is brand new. So they're throwing things at me left and right, trying to figure out, what I can do and what I can't do. So that's what I've been doing since I've been here. And I'll pass it back to Sean.
Thanks, Adrian. That's great insight. Before we move on to IRA, or the Inflation Reduction Act, I want to just ask a few questions to our panelists before we move on. So Chris, we received a question in the Q&A, and I'm going to put you a little bit on the spot here. But this one was around communication certifications. So what communication certifications do you recommend? I have an undergrad and master's in international relations already, but I want to maximize my potential.
That is a great question. Now, it really depends on what it is you want to do, because communications has become a very specialized field. There are people who have certifications, say, in conducting a focus group. There are people who have certifications in healthcare education. But I would say a lot of people we hire actually don't have additional certifications. What they have is a little bit of experience, and they've been able to demonstrate that they have that they can write for the internet, or that they've done this type of work before. Obviously, if you are in a really specialized area, like say a graphic artist, you would want to have that background, a graphic arts background. So it's mostly just about the experience you've had. International relations can be a very strong background for a person who's just for a person who wants to move into certain communication jobs like partnerships, media relations, strong writing type jobs, and jobs that require project management. By the way, the health education one, it's called a CHES, C-H-E-S. I know that's very common in several agencies. It's not one we rely on a lot, but it certainly wouldn't hurt.
Thanks, Chris. I know that was really helpful. Adrian, a quick question for you. What current opportunities or future opportunities are with CMMI?
Current opportunities, because of the IRA, I'm losing my thought. My
Inflation Reduction Act.
There you go, the Inflation Reduction Act. We have been hiring lots of health insurance specialists. I do believe there was one that was posted, I believe, yesterday at the GS-12 level. So those are coming in a lot, because I know the different groups, because of the IRA. Because of that, they are needing to ramp up staff when it comes to that. So I will look out for the health insurance specialists. There was one, as of last week, there were 3 of them. There was a GS-12, a GS-13, and a GS-14. The 14, which was a senior advisor, but that may have closed. I think there was a cutoff with that one in particular. But I would definitely keep an eye out on those particular roles, because they are coming in left and right from the different groups.
Okay, great, thank you. And I think that's a perfect segue to talk about the Inflation Reduction Act. But all of the positions, both Chris and Adrian spoke about, can be found they're all on USA Jobs. And we'll provide links to those as we go through today's webinar. So as promised, the Inflation Reduction Act, or the IRA, as it's commonly referred to internally. So as you may or may not be aware, on August 16th, President Biden signed the Inflation Reduction Act. So this new law allows CMS to negotiate drug prices, caps out-of-pocket spending for prescription drugs and Medicare, and gives Americans access to affordable health insurance coverage at healthcare.gov. So to support this new law, CMS plans to fill more than 200 positions with talented and experienced professionals in in everything from pharmaceuticals, economics, health policy, research, social science, program management, IT, public affairs, health communications, and much more. All of the positions and some more information can be found by visiting the link. One of my colleagues will post the link to the chat where you can find more information about IRA. On the IRA webpage, that's where we'll post all of our current opportunities, which will take you to USA Jobs to apply. You must apply through USA Jobs to be considered. And please be sure to keep an eye out on when the position closes. Once it closes, we're no longer allowed to reopen that application window. So please make sure if you're interested, make sure that you apply before the window closes. So I want to give a big thank you to our panelists, Chris and Adrian, today for sharing insights on the very important work that you do. And I want to say thank you to everyone who has attended today's webinar and all of our webinars throughout 2022. We held 2 webinars every month. They've all been fantastic, and we can only do it, with the audience that we have here today. So a big thank you. Everybody in OHC, all the panelists, that show up for this. They all really enjoy it, but we wouldn't do it, if it wasn't worthwhile to everybody watching today. So again, a big thank you. We'll be back in 2023 with a brand new series. Details to follow. We'll put a link in the chat to where you can find new information for the 2023 webinar. But it would really help us out as we build 2023 webinar, but we're going to launch a poll, and this helps us find new ways to improve recruitment and outreach for CMS. And so just please let us know how we did today by responding to the poll. Again, your insights help us create new webinars moving forward. Reminder that everyone who pre-registered will receive a follow-up email with the slides, and that this video will be posted to YouTube sometime in January. Again, we'll be back in 2023, and we'll see you next year. Thanks, everyone.